Hello, my name is Tom Parsons and I'm one of the core surgical trainees at Bath. I'm talking about our study into patient satisfaction with wide-awake forefoot surgery under ultrasound guided ankle block. The use of ankle blocks for forefoot surgery have been previously described in the literature, however are not widely used currently in the UK. This study from 2018 exemplifies positive feedback using a landmark technique. We were curious to see how our ultrasound guided established technique fared. Our study involved 47 procedures done over 2 years. The block itself was administered by an experienced anaesthetist using our established protocol. Feedback was collected via a postal survey, and if there was no response, we called the patient. This slide demonstrates our ankle block technique. We use a sharp, non-fenestrated needle to try and minimize pain. We use a mixture of lidocaine, levobucaine, and dexamethasone. And we sequentially target the nerves, starting with the largest and most important, the tibial nerve, allowing as much time as possible for that to work. We then test the block before the patient moves into surgery, allowing for any extra top-ups if required. Patients are given information at the time of booking and on the day of surgery as to what to expect. In terms of results, we had an 87% response rate with only 6 lost to follow-up. Regarding information supplied, patients were on the whole very satisfied with information both before and after the operation. Regarding symptoms during the procedure, unsurprisingly there's a spectrum of symptoms experienced while the block was administered, but the majority still experienced no or mild pain. During the procedure itself, only 2 patients had mild pain, the rest experiencing none at all. And post-operatively, again, there was a spectrum, but the majority experienced no or only mild pain. When asked whether they would undergo this procedure again, the vast majority, 98%, said that they would be happy to. When asked about how they felt being awake during the operation, common themes included a preference to being awake. They felt more involved. A small proportion felt quite anxious about the procedure. Some commented on the noise during the procedure, and one patient did say they preferred to be asleep. Other comments include positive interactions with staff, perceived faster recovery and improved safety. However, some patients did feel they had a lack of information after the operation. The strengths of this study is its high response rate with only 6 lost to follow-up. Limitations: it is a fairly small series. Interpretation of the survey by the patients may have confounded the results, with some patients talking about pain in the days after their procedure, which of course is more related to their surgery as opposed to the block itself. In conclusion, the majority of the feedback was positive. Patients perceived several benefits. But there are obviously areas which have potential for improvement, such as pain during administration and information after the operation. Take-home message is that ultrasound guided blocks are well received by patients. They may in addition provide a cost-effective, safe and effective alternative to general anaesthesia at a time when we're trying to avoid aerosol generating procedures. In the future, we look to investigate the timing and efficiencies of running such lists and doing a full costing. Thank you for listening.